so the first thing that I'm going to do is verify the care for my patient. I would then perform hand hygiene before and after caring for the patient and before and after assembling any supplies. I would verify the facility policy and procedures for all supplies that I need and assemble the ones that I need. I'd also consult the manufacturer's recommendations for all supplies that were involved. Then I would be ready to knock on my patient's door, identify them using 2 patient identifiers, note their overall condition, explain the procedure to them while I provide for privacy, elevate the bed for good body mechanics, don my PPE if necessary, perform my task, and when it's complete, I would lower the bed, raise the bed rails according to the patient's care plan, place their call system within reach, and identify any abnormal findings to the charge nurse. So the first thing that I'm going to do with wound care, I'm going to put on just some regular old gloves here. Of course, I've already done my hand hygiene. We would also want to note that before doing wound care, any medications were administered 30 minutes prior. So now I'm going to expose the patient. And we have an abdominal wound here. Okay, so the first thing that I'm going to do is hold the skin taut while I get this tape off. And I'm going to remove the gauze away from the patient so that they don't have to see it. And when I look at my gauze, I'm going to look for any drainage, the color, any odor, the amount. I can weigh the gauze if necessary. Then I'm going to dispose of all this stuff. Of course, I would perform hand hygiene after taking off gloves and put on new gloves. After we get our new gloves on, which are very tight on my hands, after we get our new gloves on, we're going to start assessing the wound, and we're going to assess it for any further drainage or bleeding, any redness around it, what kind of wound it is, if there's any slough or eschar or any of that stuff. Then we're going to take our measuring tool here, and at the longest point, I'm just going to use centimeters. So it's about 13.5 inches long. We're going to measure the width at the widest point. So it's about 3 centimeters wide. I'm going to dispose of this. I'm going to take a cotton tip applicator, one of these right here, and we're going to check for any tunneling or undermining, and if there were any, then we would use like the clock system for which direction that it went in, like tunneling or undermining at 3 o'clock in proximity to the wound. After we check for tunneling and undermining, we're going to measure the depth of this on the back of my little package here. So it's about 2 centimeters deep. And I'm going to dispose of this as well. We'll dispose of these gloves, perform hand hygiene obviously, and now we're ready to get to my sterile field here. So I'm going to grab along this 1-inch border. I'm going to open it away from me first, then on its 2 sides, and then toward me. I'm being really careful not to contaminate my sterile field here. I've got my little gauze here. I'm going to open it away from me, not to contaminate it, and I'm just going to toss it down like that. Get rid of this. I got my normal saline. I'm going to place the label in the palm of my hand after I check for the expiration date, of course, and I'm going to pour my normal saline like this. We'll set that out of the way. Now I'm ready for my sterile gloves. So we're going to take them out of their pack, throw this away. And this also has a 1-inch sterile border that I can touch without contaminating it, so I'm just going to make sure and get this good and open. Sometimes they don't like to stay open. The first one I'm just going to pinch on the inside with my 2 fingers and slide my hand in like this. Then I'm going to slip my fingers underneath the cuff with this one. And Now I've got them on. Okay, so now I've got my sterile gloves. I've poured my saline. I've got my gauze. I'm going to clean the wound. That's going to be the first thing that I do. So I'm going to take some of my wet gauze. I'm actually going to start in the center of the wound and clean out. I'm going to get rid of that. I'm also going to start in the center of my wound and clean out in the opposite direction. We'll get rid of that as well. I would start cleaning the outside around the wound and the outside around the wound here. Then I'm going to pack the wound. So what I'm going to do here is take one of my gauze pieces and kind of fluff it out like so. We're just going to place it on top like that. And I'm going to take 2 more cotton tip applicators and kind of pack it down in there. I'm going to make sure that it's not any higher than my wound bed and it's not overlapping onto the healthy skin and tissue. So once we get all this good and packed down in here, we'll get rid of these. Then I'm going to take 2 more pieces of dry gauze and overlap them like this. Then I've got my ABD pad. And I'm going to take this with the blue line up and just lay it over the wound like so. Then I've got my tape here. A lot of people prepare their tape in the beginning, but not me. So I think that's a pretty accurate measurement. So we're gonna start taping it down here. And once I had this tape on there, I would make sure that I put my date, time, and initials on there. And there we go with wound care.